Hearing is very important for a child's overall development. And what a lot of people don't understand is it's not only hearing development, it's brain development. One of the great things that we as audiologists can do is we can get a child the amplification they need so that they can hear everything they need to be hearing, such as their mother's voice, their father singing to them, the dog barking, the doorbell ringing, all of these wonderful things, so they can start to associate what that sound means. And when they build those associations, that's how their brain develops, and that's how their brain grows.
Cincinnati Children's has one of the nation's largest pediatric audiology programs, made up of doctoral-trained audiologists who specialize in working with children of all ages.
Cincinnati Children's Audiology is a leader in the state in both providing services, but also in leading services.
We're doing hearing tests every day. We see private appointments, but then we also staff our ENT clinics. So we have a great working relationship with the ENTs and the ENT nurses. So that way families can come in for kind of everything all at once. They can see their ENT physician, and then they can see audiology for a hearing test. We also work with hearing aids, cochlear implants. We do auditory brainstem response tests on newborn babies. We do vestibular testing, balance testing up at our Liberty location. So we do a lot of things besides just regular hearing tests.
This is such an exciting time in audiology. We are on the cutting edge on some really, really cool things that are really going to help kids have better hearing and balance outcomes.
The Vestibular Lab here at Cincinnati Children's is very unique. There are very few programs in the country that specialize in pediatric balance testing. We work together with physical therapy, with ENT, and we've come together to put together a program for children who are suffering with balance disorders. Specifically kids who have inner ear anomalies, so they might also have hearing loss, kids who have had concussions that then have dizziness afterwards, kids with migraines, they can also have experienced dizziness as well. And we work together to look at the evaluation portion and the treatment portion for these kids.
Another area where Cincinnati Children's Audiology is leading is in using telehealth to connect with children nationally and internationally to do cochlear implant mapping of their devices. Even though the children aren't physically at Children's, they still have access to our expertise in this area.
We're also working with Telehealth Services for children who are in rural areas, who don't have the audiology services close to them. We're able to connect with them via a secure web link and provide services to them which they would not be able to get otherwise.
People look to Cincinnati Children's as the leader in audiologic care, and that's something we're both proud of but also realize the responsibility for.
Cincinnati Children's continues to research and pioneer in audiology services, but what truly separates Cincinnati Children's is the commitment to care and compassion for families.
In so many ways, these children that we're trying to help become our family, and so we care about what happens to these children.
I love the work that we do here at Children's. I really feel like we make such a big difference every day.